I'm Associate Professor Megan Rees and I'm the head of the Respiratory and Sleep Disorders Unit at the Royal Melbourne Hospital. And today we're going to be talking about asthma. Asthma is a condition where your airways narrow, and they don't narrow permanently, but they narrow intermittently. Our airways go down all the way through our lungs. You start off with your windpipe and then branch to smaller and smaller airways all the way to the air sacs or alveoli, where the oxygen is taken into your blood. And those airways have tissues in the sides of them, and if they become inflamed, they can swell and narrow. They also have muscle in their walls that can contract as well. So asthma medications break that cycle of inflammation and narrowing in the lungs. It affects approximately 11% of the Australian population and can happen in any age group, from very young children all the way through to elderly patients. Asthma can be associated with a number of symptoms, and they can vary from person to person, but the commonest are an episodic sense of breathlessness, also chest tightness and a wheezy noise when you breathe, and occasionally a cough, and sometimes a persistent cough that can occur at night time as well as during the day. So the first thing to do is get in touch with your GP. They're a wonderful resource and they look after lots of patients with asthma, and your GP is likely to take a history and talk to you about the different symptoms that you have and look at the patterns of those, how they might vary with day or night, or with exercise, or with the seasons. And then you may need to go on to have some specialist testing, and we do that specialist testing here in our lung function laboratory. Also, there's a simplified testing that can be done in your GP's practice. So the cornerstone of diagnosing asthma is spirometric testing, where we look at your lung capacity, how well you can breathe in and breathe out, and how quickly you can breathe out large volumes of air. So we get you to take a very deep breath in and then blow out as hard and fast as you can. And we measure both how quickly you get rid of the air and also the total volumes of air that you can move in and out of your lungs. We then get you to take a deep breath back in, and we measure that as well.